Hello, everybody. My name is Jess Posner, and I am the Director of Virtual Programs and Membership Services of the YMCA of Central New York. I am really very excited to welcome you all tonight to the second event in our month-long speaker series focusing on mental health awareness, featuring the incredible Dr. Kaushal Nanavati. We unfortunately, there he is. So we unfortunately had to postpone last week's event with Chris Kosakowski from the Vera House last week because he did fall ill. We are really happy to share, though, that we rescheduled that event for June 2nd. So please mark your calendars. It'll be the same time, same link location, and it'll be there, and it'll be a great time. He's a very compelling speaker and is slated to speak to some very significant issues of kind of like cultural violence on both a small and large impact, and like how that has an impact on our mental health and how we can develop some tools and frameworks around that. So I'm very excited about it. So I just want you to put that on your calendars as well. I'd also like to say that Dr. Nanavati has a lot of fans at the YMCA. Even though we have a pretty intimate group tonight, I did receive a lot of emails from folks who are really looking forward to seeing the recording of this, which will be living on the virtual YMCA and our YouTube page. So this will be a resource, not only for those in attendance tonight, but for anybody that would like to access it for, as long as the internet is around. So before we begin, maybe not that long, but as long as I'm in this job at least. So before we begin, I would like to offer just a little bit of virtual housekeeping. You will notice that everyone was automatically muted when you entered. This is to help maintain a pleasant experience for everybody. So I'm going to ask that if you are not the speaker, to please keep your sound muted, but you can communicate with me at any time via the chat box, and I will be monitoring that chat box to collect questions and comments for the question and answer session following Dr. Nanavati's presentation. I will be spotlighting our speakers tonight, which means that they're just gonna be made big for you, but to turn this on, you have to turn on the presenter view. So if you go up to the upper right-hand corner of your screen, which is either this side or this side, I'm not sure if I'm reflected, but just go ahead and click on that, and if you click presenter, you should see me quite large. When we are recording the session, I just wanted to let you know that any publicly shared version of the video will only include my or Dr. Nanavati's feeds. And if there are any names or anything like that, I will edit those out for anonymity in the post-production. So without much further ado, I would love to do a very brief introduction to our esteemed guest, Dr. Kaushal Nanavati. And if I left stuff out, which I definitely did because he has such a robust, interesting career, I know that he's going to fill us in on quite a bit of that, as he is quite the storyteller. May is Mental Health Awareness Month. Since the beginning of COVID-19 pandemic, the Center for Disease Control has issued studies that reflect that US adults reported considerably elevated adverse mental health conditions associated with COVID-19. Younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers reported having experienced disproportionately worse mental health outcomes, increased substance abuse, and elevated suicidal ideation. As we know, the pandemic is going to impact so many of us for so much longer, many of us probably for the rest of our lives. So it is my great pleasure to introduce Dr. Kaushal Nanavati, who has been studying and writing and innovating around integrated wellness for a significant amount of time. I remember you told me how long you've been at this business, but I'm assuming it's your whole life. And he is, I would say, like a dynamic polymath of a physician whose deep investment in wellness and community is reflected across his impressive and very grounded career. He is the current Assistant Dean of Wellness, Director of Integrative Medicine, and Assistant Professor of Family Medicine at Upstate Medical University. He is a motivational speaker, an integrative family physician, and an author with a passion for leading people toward improved wellness, self-care, and peace in life. He believes that overall wellness is a primary means of disease prevention. So without further ado, I'm going to go ahead and turn the virtual stage over to you, Doctor.
Well, thank you very much. And, I think I should just stop while I'm ahead with that kind of an introduction. So I want to welcome everybody for coming. Thank you very much. I'm humbled to be here. And the leadership at the YMCA and I have been working together for a lot of years to try to improve health and wellness within our community. So today I'm going to speak about this idea of mental health, wellness, and integrative medicine and what they mean. And I want to kind of define some of the terms for you as well. So I'm going to just share my screen so you don't have to look at me anymore. By the way, that music was great in the beginning. I was, boogieing down a little bit. The Club Nouveau version of Lean on Me is one of my favorites. So thank you for that. All right, so I'm sharing my screen. Thumbs up, we're good? Okay. And people can put stuff in the chat and I'll let Jess kind of moderate that as necessary. So if along the way a question comes up that somebody has a question on that's relevant, Jess, you can stop me and kind of chime in as well, okay? All right, so let's talk about some definitions in terms of what mental health is, what wellness is, well-being. But to know me a little bit better, she gave my professional titles, but really my identity is, listed here as well. A husband, a father, a son, a brother, a friend, a doctor, and a teacher. And I've been in Central New York for the last 25 years as a family physician, having trained in Lafayette, south of the city, worked in Central Square, north of the city, had a private practice in Baldwinsville where I live, west of the city, and now for the last decade at Upstate in the city of Syracuse. We say the city and people from New York City, think, wow, Syracuse is not really a city, but yes, we are. And so, there we go. So disclosures, I've written a few books on wellness. And so some of what I'm going to talk about relates to this. But those of you that are listening are going to get the core content, so you don't have to go out and get any of these because I'm going to share most of it with you today. And so well-being, right? So mental health is really a state of well-being. This is a definition from the World Health Organization, a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. Now, the introduction was about the state of distress as a result of COVID and how that's become heightened. And we see this every day in the practice of medicine. We see it in society. We see it in our relatives and relations. And on a personal note, in the last weekend between Saturday and Monday, our family lost 2 relatives in India to COVID. So this is something that does hit home for me and for our family. And at the same time, I think about the fact that we have an opportunity and a role to play within not only society, but in our own lives to not only optimize our own living experience, but in doing so, a saying that I like to often use is to be the light that shines brightly so that others may know the way. And all of us have the potential to do that through our living experience. And so I want to talk more about how we do that. And I want to give you some practical tips. And if some people have to leave early, I've kind of peppered the practical tips throughout this presentation. You can obviously get on the web and see it, as we've been told it's going to live in perpetuity. But at the same time, I want you to feel comfortable and relaxed as I'm talking, because, when you think about mental health, it means a lot of different things to a lot of people. And while this definition is very broad, when people think mental health, they often go straight to mental illness and everything from depression, anxiety, stress, substance abuse, violence against sexual abuse, and also chronic conditions, degenerative conditions like Alzheimer's and Parkinson's. And the living experience as a whole impacts our mental health and our well-being. So wellness and well-being are 2 different things. And wellness, in essence, is what systems or social structures offer that allow people within that network to have an optimal experience. Well-being is what people do for themselves to optimize their living experience, right? And so a lot of what I'm going to talk about relates to our well-being, what it is that we can do for ourselves, and when we can do it individually, and then can do it in our relationships, then that leads to an impact on community as well. And so that's what I'm going to talk about a little bit. Right? So this is some of the data that was from the WHO as well. And again, this is pre-COVID data, right? So when we think about it, between men and women, there are some differences beyond what we would know to be obvious differences. So women tend to have increased anxiety relative to men. Men tend to have increased percentage of substance abuse. And then affective disorders that affect our expression in many different ways. Women tend to have more of those. And then any mental disorder as a whole, women tend to have a little higher percentage than men. But some of that also ties into, and there are multiple factors. So when we see data like this, we think, oh, this affects women more. Well, when you think about visits to physicians' offices or visits in the healthcare system, women tend to be more proactive about getting doctor's appointments and even seeking help. And so while this data does show us that there's a discrepancy, I'm not sure we really know the exact numbers in terms of how accurate that is. But even if this is the case, nearly 1 in 3 women and 1 in 4 men have some degree of issue that affects their mental health, right? And so it's very common. And because this is common, we think about the fact that there are multiple factors that affect your mental health, right? So when you think about mental health, what are the components? Well, your physical well-being, right? Your psychological state, your emotions and how you manage your emotions. We think about your finances and financial well-being. We think about your spiritual well-being. And all of these different components have an effect on our mental health. So all of us are unique, and at different stages in our life, we're in different circumstances and have different factors that affect this mental health. So there's no static solution because we're not static beings. We're dynamic throughout our lives, and we're always transforming, we're always learning, and we're always transitioning to different stages of life. So it's important for us to reflect back, and that's where things like and terms such as being mindful or using mindfulness or reflection, these are all things that are ways that can help. I'm going to talk about that a little bit as well. So a story. I was told that you were forewarned that I like to tell stories, and so this is a nice saying: peace. It does not mean to be in a place where there's no noise, trouble, or hard work. It means to be in the midst of those things and still be calm in your heart. Right? Great quote. And the way I came upon this was 10 years ago. I joined Upstate, and when I did, my chair at the time gave me his cubby where he worked, and also allowed me to work with the nurse that had been working with him to ease my transition. So very, very kind of him. And he had left this mug on his station, so I would see this every day. And then about 5-6 months later, I turned 40, and we were at home at the dining table, and my son, was about 9 years old at the time, and 8 or 9, and he was looking at me and he goes, well, 40, that's a hallmark birthday, Dad. So, where do you want to go? You want to go to Hawaii? You want to go somewhere? And, for some reason, and I'm a little bit younger than the hippie generation, but, and I'm teasing, by the way, but I said, you know what? I just want peace. And at that time, my wife puts over, kind of pushes my gift across the dining table, a small box, and I opened it up, and it was the same mug with the same quote. And she had no idea that for 6 months I had been looking at this every day, right? And so that was a unique moment that sticks in my mind, that oftentimes the universe is, kind of giving us the answer. Are we paying attention? Are we open to what's being presented? And are we willing to embrace that, right? There's a saying that I recently come upon just in reflection, which is that trust requires faith and faith requires trust, right? And so often we have to trust in ourselves and have the faith to believe that we can overcome. And as they say, the champion gets up one more time, right? So when we do feel down, when we do feel stressed, when we do feel overwhelmed by the circumstances what COVID has brought, one of the things to remember is that together we're going to be much better off than we are kind of distancing ourselves from others. And a lot of people have felt isolation. A lot of people have felt loneliness. And some, on the other hand, have found that the alone time has inspired them to build better, to work on themselves, whether it be their physical health, whether it be career development, whether it be looking for new opportunities because doors have been closed or doors are closed. And so different people approach it differently, and we're all unique in that. And so being the best is relative to others, but being your best is up to you, right? You know, I have medical students that I teach all the time, and even my son, when he was going through high school, you know, we would talk about, every so often he would, you know, bemoan a grade that he got or something. And he always wondered why we didn't really ask him too much about his grades. And the simple thing we had said was it your best? And he said, but it wasn't the best in the class. And I said, well, if it was your best, it's the best you could do. So then the rest don't really matter. But if it wasn't your best, even if you got the best grade in the class and you got a 50, was that really an achievement that you want to be proud of, or is there something more that you could have done? And so a month ago, he's finishing up college actually this week. And a month ago, he said, you know, I think you guys, you know, really tricked me and played some mind games with me. And we were joking about it. And he said, well, because you didn't really look at my grades much, but, you know, you said the statement, you know, was it your best? And then you left it. And so now my mind is always thinking, is it my best, right? And from our perspective, we were trying not to be pushy and just embracing the fact that he was putting his best effort forward. And then from his perspective, it was a little bit of pressure because now he was applying it, you know, to himself. So, you know, check plus on our parenting side that on the one hand, we thought we did something wonderful. And he actually embraced the concept and now thrives. But at the same time, he also gave us a perspective on it that we didn't realize. And sometimes we think we're doing something that's in the best interest of the ones we love, but getting feedback is very valuable to know if it's hitting the mark. And if not, then we can adjust and we can adapt, right? So stress management incorporates a lot of different things. Exercise, had to put that plug in since our hosts tonight are the YMCA. Yoga, Tai Chi, journaling, reflection, direct communication, art therapy, aromatherapy, social work, financial advising, hypnotherapy, psychotherapy, psychiatric care, acupuncture. There are multiple modes. And while we're in a limited time, I can't get into everything. I'm going to speak to you about those core 4 concepts specifically related to nutrition, physical activity and exercise, stress management in terms of a practical approach, and then your sense of contentment and peace. Right? So emotional health and well-being, right, are intertwined, and negative emotions aren't necessarily negative because they actually alert us to danger and enhance our survival. So if we're feeling fear or frustration or anger or stress or distress, it's an opportunity to step back and reflect on why, right? What is it specifically that's affecting you, right? Because when you get clarity on that, now you have the opportunity to come upon a solution. When we don't have clarity and we just sit with the emotion, but not the root cause, now what happens is we feel the feelings of the emotion, and that over time affects our biochemistry, right? So when we're stressed, cortisol, the stress hormone, goes up. When you stay stressed for a long time, that affects blood pressure, it affects blood sugar, it affects your immune system, it affects inflammation in the body, it affects what we call oxidative stress or precancerous change. And so when you feel the feelings, it's important to step back and reflect on the root cause, the why, right? Why am I feeling this way in this moment? And as you reflect, you have to be honest, because we oftentimes in our own self-talk will make excuses for. And in this case, the bottom line is you're just fact-finding, right? It's not about judgment. It's not about blame. It's about finding out the root cause. And when you do, that gives you an opportunity to start shifting your story, right? It's to start shifting the journey ahead. So positive emotions signal safety, enhance memory, verbal fluency, right? And facilitate new learning, right? So when I embrace each day as an opportunity, I'm going to walk into it seeking out those things and seeing even the challenges that are presented as ways in which I can learn something different, learn about my own limits, learn about my boundaries, right? And grow from that process. And sometimes, people say, well, your limits and boundaries are defining and they actually limit your growth. Sometimes they actually enhance your growth when you have clarity, because now what happens is you gain confidence, right? And that confidence allows you to communicate in a different way. It also allows you to be able to work with other people, to be able to say, here is what my focus is, and this is what I want to build upon, right? Humor in the face of hardship can improve well-being and physical health. And this is something where, and I'm doing it right now. If you guys can see me in that little box on the side of your screen, I'm smiling, right? Now, when you smile, cortisol, that stress hormone, goes down, and serotonin, our feel-good chemical, goes up, right? And so that enhances your well-being. Serotonin not only enhances your mood, it has more receptors in the gut than it does in the brain, and that affects your gut motility, which then affects your nutrient absorption and toxin release, literally creating a healthier physical you, a physical biochemistry that then signals back to the brain. And so the food and mood cycle, or the gut-brain connection, are very, very much real and alive all of the time, right? And so there's something called the Appreciation Audit. And this is something that has actually been studied. And basically what you do 3 times a day, take 3 to 5 minutes to think about 3 things in your life that are positive. It could be as simple as the lunch you had, right? We have a salad at home that we make called the Green Joy Salad. And the dressing is a little bit of balsamic vinegar, some olive oil, and a little drizzle of local honey. And when I take that salad from 8 to noon, I'm smiling because I had that thing. And from noon to 5, I'm smiling because, again, I had that thing, right? So I get 8 hours of joy from a simple salad, right? And, that basically defines some of my, perspective, which is to say, when you set the bar low enough, you can find joy in a lot of things. But realistically, it's also a healthy way to be, right? So the Appreciation Audit is one tool that's a tangible that you can apply starting today. And if you work with others or within your own home, if you find that people are having some distress, this is an active step that you can start taking with them, whether it be your children, spouse, relations, whomever, parent. It's important for people to take the time to reflect on what it is in their life that has a lot of value. And it can be as simple as, from taking a breath to having a meal or sharing a meal to reflecting on a memory that makes you smile, right? And why we care about this stuff, because I think healthcare as a whole has historically been focused from the ground up on disease prevention. So even here, the focus was mental health. How do we prevent mental distress, right? Well, why can we not focus on how do we maintain a healthy perspective? Because I think that's the first place to start. And then when there are moments where we lose that, then we can work on building it back up, right? Disease management are the branches, right? Some, go in different directions, right? Psychiatry, psychology, social work, all of those different specialties, neurology, and primary care, family medicine, pediatrics, obstetrics, and gynecology. We have all kinds of different specialties in healthcare that support our mental well-being as well as our physical well-being. And then there are innovations, right? Some become new branches, some fall by the wayside. But the roots are wellness promotion. And I put this slide here partly to explain healthcare. And when you think about it, hospitals, physicians, most of what we consider to be the healthcare providers are actually from the ground up, right? They've been focused on disease prevention, disease management, innovations, even the business models historically for hospitals, healthcare providers, insurance companies reimburse for disease-oriented care, not so much for wellness-oriented care, right? But who benefits from wellness promotion, right? Well, our sponsor does, right? The YMCA, because people come there to be healthier. Yoga studios, and even insurance companies to some degree, because if their clients are healthier, then they're not going to have to use up the funds that they collect from our premiums as much, right? And then hopefully that can lead to lower costs over time. So a more optimal health system would be one that would partner the wellness promoters with the disease preventers and disease managers and the innovators, right? And, you know, companies like pharma, and pharma sometimes gets vilified, but, you know, they're often the innovators that are bringing us, technologies and resources to help us manage illness and dis-ease. And so we have to think about how each player has a role in optimizing our health system, right? And so that's very important. But the other reason I put this slide up is because a tree without roots provides very little shade, right? Again, hey, Kaushal, that's a pretty obvious statement, right? And the point there is root yourself in a sense of health and wellness, right? Do the things you need to feel contented, to be at peace, right? To find and regain the sense of purpose. High schoolers and elementary schools kids, you know, we always used to ask them, what do you want to be when you grow up, right? We don't ask that anymore. What we ask is, what do you wish to contribute, right? And that helps them to define a purpose, right? And then they can, from there, think about how they wish to meaningfully contribute. I ask my medical students at orientation every year, you wanted to be a doctor. Why do you want to be a doctor? And most will say, well, I want to help people, right? And so I remind them that there are multiple ways in which we can help people in society. I know so many people who do so many things that are actually more practical. In fact, every week on Tuesday mornings in our neighborhood, a truck comes by with some wonderful souls that take away all of my garbage, right? My garbage man actually helps me more than my doctor does, right? Because if they weren't here every week, like my house would, it'd be a problem, right? So when you want to help people, when you want to do things as a contribution, it doesn't require a title, right? And when my students are going through schooling, one thing I remind them is, you don't become a doctor the day you get the MD. You get the MD because you became a doctor, right? It's walking the path, it's doing the work, right? We don't chase titles, we actually do the work. And when we do, we gain greater fulfillment throughout the process versus saving it for some outside external goal, right? And I've got a slide on that I'll share with you as well. So I think about life as a dynamic, right? I've never surfed, I've got to admit, disclaimer. But when you think about life, it's like the wave under the surfboard. It's constantly changing, constantly dynamic. And as it evolves, we have to constantly keep rebalancing, right? So if I get stuck looking behind too far, I'm going to fall off. And if I lean too far forward, I'm going to fall off. And so the best I can do is balance in the moment. And if there's one thing that I've learned from this time during COVID, it was recognizing the true value of the things that I do have in my life, right? When people couldn't go out to restaurants, when we couldn't see people and be in their presence as often, the one thing we realized was how important they were to us. When we couldn't go to restaurants, what we learned was, we can actually cook within the home. And it's actually not a bad thing to share time because the bonds are better. More people I know were doing game nights. More people I know were doing things like cooking together, even, Zoom dinners, etc. And I understand there's a lot of Zoom fatigue. We're on Zoom right now. But that being said, it's allowing us to connect, right? That's a positive, right? So, a half empty glass is also half full. Sometimes a drop of water in the bucket is the first place to start. And then we keep filling, right? We keep filling. So now to get into a little bit of the nuts and bolts, and this is more of a self-reflection for each of us. Human behavior is a very interesting thing. This comes from the world of public health, that behavior change in people happens for one of two reasons. Either the fear of the consequence is high enough, right? What we call the perceived threat, that they want to avoid the consequence, right? And so they go away from it. Or the reward is perceived to be great enough, the perceived benefit, that they really want it and they're willing to do what it takes to get it, right? So each of us can reflect on in your own life, when you've made changes, right? Has it been because you were avoiding a consequence, or has it been because you were wanting something badly enough that you were willing to do what it took to get it, right? And why that matters, because that affects self-talk, right? And when you know that about the people in your life, right, then that affects the way in which you communicate with them. So to a risk-averse person, if you talk about rewards, that's not really the thing that's going to get them to shift their thinking, right? Or to a reward-oriented person, if you talk about punishments, they're not really concerned about that. And so for yourself, think about what it is that motivates you to change behaviors, and then you can gather information that will support your ability to make an informed decision that invites contentment and peace into your life, right? And I have this later on, but I'm going to say it now. All you need in life are two things: contentment and peace, right? Everything else is a want. And if any of your wants take away from your sense of contentment and peace, think about where your priorities lie. And these two words aren't like a static definition again, because life is dynamic, as I mentioned. So every so often, we have to redefine these things at stages of life where we have transitions, right? It's important to reflect on, am I contented and peace? And moving forward during this phase, what does contentment and peace mean for me, right? During COVID, for a lot of people, contentment and peace meant keeping the lights on, right? Having enough resources to take care of the children, right? Trying to figure out how to make it through a day with trying to educate the child at home while also trying to get the work done. For teachers, and that's one I'll give a call out to teachers. When teachers have to teach in hybrid models, right, where there are some kids in class, some kids at home, and you're trying to navigate that and to educate at the same time, very, very challenging, right? And school districts were, kind of hard pressed to figure out best solutions, which was difficult for administrators. Parents were trying to figure out best solutions because they were torn between, working/children/other responsibilities. Kids were struggling because, again, sitting at a computer screen, attention spans are very difficult to hold on to, right? So, these circumstances aren't one where it's so easy to just fault someone or something. The reality is it also exposed a lot of weaknesses. And at the same time, it also helped us to understand that we actually can embrace current technologies and future-looking technologies to help bridge the period until we get to a more stable footing, right? And so that's important to pay attention to. So the core concepts: balance, buffers, and this idea of Buddhism, I like to call it. I minored in religion and philosophy and literature in college. And so when I took a course on Buddhism, that really struck me. But, balancing your life, who else can do it but the person in the mirror, right? So if you feel out of balance, think about what that is, right? Why? And I'll give you a couple of thoughts on that. Buffers, keeping a little reserve in your system, right? So a lot of us plan meetings, but we don't plan the time to get between meeting A and meeting B, right? So people don't really put, although I'll tell you that at least I have the iPhone, but on the iPhone, when you plan a meeting, you have the option of buffering time, travel time, before and after. That's very important, because if your cup is always full, then any little stressor and everything's going to spill over, right? And so giving yourself an opportunity, whether it's financial buffers, right? What do they say? Live at, 80%, right? So you have a 20% buffer. For younger generations, it'll be more like live at 50%, right? So that you have a broader buffer, because, the system isn't necessarily going to guarantee the same retirement in terms of Social Security, et cetera, based on current projections, right? Emotional, right? Buffers. If we are always on edge, then any little thing that goes not according to plan, it's going to frustrate us, right? because we're not ready to accept and tolerate any little variance from what we want because our box is so full. So creating buffers is very important, right? And there's Buddhism being like water. You know, water strong enough to cause you tsunamis and hurricanes, and yet it's the softest substance in the world, right? And solid, liquid, or gas, it never loses its core, right? And so to be like water, sometimes you got to be the tsunami, right? You have to be the force that corrects what needs to be corrected. And sometimes you have to be the gentle brook, right? Nurturing and being patient, being understanding, being humble. And so there's a lot we can learn from nature. And this is kind of the summary. And so since this is going in perpetuity, this will be available to all of you. And in fact, if you type in core 4 fundamentals of wellness, so the core number 4 fundamentals of wellness, it's actually, this handout is on the web. And so it's easy enough to access. And these are the fundamentals: nutrition, physical exercise, stress management, and spiritual wellness, right? And for nutrition, probably the best resource that I can think of at this time is Harvard's Healthy Eating Plate. And you can just type that in to your search engine, and their website has wonderful information, evidence guided, and they continue to update it based on new evidence. They even have recipes on that site, and they explain things, right? So a lot of people during COVID are also, you know, the COVID-15 or the COVID-30 or more. And, you know, I've met two kinds of people. Those who, when COVID hit, say, you know what, this is just too much, I can't do it. And they stopped, you know, exercising, doing anything physically engaging, etc. And then the other group that said, well, can't go anywhere else, might as well exercise, right? And so there were two types of people. But it was important for us to understand that, again, this can be seen as an opportunity to do the things you can do versus bemoaning the things that you can't do, right? And again, there are certain stressors such as job loss that are very difficult to navigate, especially when you have responsibility for other people. And we do feel badly. And, you know, where we as a society can support, where we as individuals can support, I think it's very important to be able to do that. Even just lending an ear sometimes gives a great opportunity for somebody to think through a process and reflect, right? So nutrition, the key is 7 to 9 servings of vegetables a day. And what we know within that, so recent data says as little as 5 servings of vegetables can actually improve risk of cardiovascular disease and cancer, okay? But within the vegetables, 3 servings of cruciferous vegetables a day in some studies have actually shown to be able to stabilize or even reverse plaque in arteries, which really no pill does. So, you know, this really matters. And when it comes to mental health, when it comes to stress, anxiety, depression, we actually have some data. So eating a high sugar load can actually make somebody more anxious if they have anxiety, right? And then, you know, the classic saying, sugar high, sugar low. So suddenly somebody who has depression may actually feel even more low. So you want to check your nutrition, right? Even things like gluten and dairy for some people can affect their mood. And so sometimes nutrition and the nutritional change alone can be enough to have an impact. And I'm going to talk about the other 3 as well, right? So even if you tune out after this, you know, the idea is 7 servings of vegetables a day, okay? 7 hours of exercise weekly, and 7 hours of sleep per night. So we call it the rule of 7s, right? Live by the 7s. And if you can come close to this on most weeks/days, then you're going to be creating your best health, right? Whatever that may be. And again, all of us have a different chassis, a different body, different genetics, different potential. And so if we focus on our own potential and optimizing that, that's the best we can do, right? And if we're doing that consistently, then we can be at peace and we can be contented with the outcome of that, right? And so I always say, you know, if you're contented and at peace, the next moment becomes bonus, right? Because at the end of the day, you're already there, right? You have that sense of satisfaction. And that doesn't mean that you can't have goals and shouldn't have goals. But what it does is now those goals are ones that actually are things that if they don't fully get achieved, you still come back to contentment and peace versus discontent. And I'll share a story with you. I had a lady that came to me, and she had a diagnosis of cancer, and she had brain cancer. And once her surgery was done, she was feeling fine, and then the cancer came back. And when it came back and they did surgery again, when she woke up, her arm didn't work. One of her arms didn't work. It was paralyzed. And so she was referred to me by her oncology team. And I said, oh, okay, so what brings you in? And she said, well, they told me that you'll get me my arm back. And I thought, wow, that's a pretty tall order considering what's just happened. And so she said, this is not acceptable to me. I need to use my arm. And so I've got to have my arm back, right? And so what I talked to her about was this idea that when you start from a place of rejection, right? She was rejecting the fact that her arm didn't work. When you start from a place of rejection, wanting something, nothing in between is good enough, right? Until you get that thing, or unless you get that thing. But if you start from a place of accepting the present as your reality, wanting something, every little gain can be celebrated, right? And so it's again a mindset, right, that allows you to continue to journey towards a goal, but one invites joy through the process and the other is distressed. And then if the goal isn't achieved, then you feel lost, right? Think about two Olympic athletes, right? One who has the mindset of, you know what, if I don't get the gold, it's all for nothing, right? They train, they don't talk to anybody, they go to the Olympics, they stay in their little room and work out and don't make friends with other people from different countries, etc. And then they get to the starting line and, you know, they look to the left, they look to the right, maybe for a second, but they're zoned on that goal, right? That I want to win, I've got that finish line in sight. And then they run the race of their life. And when they're done, they finish second, right? And now they've had this miserable experience the whole time and they're dejected at the end, right? Then you got somebody like, you know, Usain Bolt, who, you know, is having fun during the training, playing with children on the beach, giving interviews, comes to the Olympic, meets people from different countries, makes friends, you know, shares pins, all those things, and then gets to the starting line, looks to the left, looks to the right, and then looks in the stands to see where the cameras are. So he knows how to pose and where to pose while he's running, right? And then he runs with a smile on his face the entire time. And, you know, regardless of the finish, this guy had a great journey throughout the process, right? So it's a mindset that allows us to start from acceptance. Every morning when you wake up, if we start from acceptance, journeying the day, we can find opportunity for micro celebrations, right? And there's value in that, right? And then 7 hours of sleep a night. So what we know is that with sleep, between 7 and 9 hours is the optimal time. Less than 7 or more than 9, and that can actually have an effect on our health, especially specifically with obesity. Data shows that more than 9 hours or less than 7 can actually lead to weight gain for some people. So again, live by the 7s, right? Now I want to get into a little bit. So people think integrative medicine and they think, you know, supplements and herbs. Integrative medicine is actually conventional plus complementary medicine. And so complementary medicine is the stuff that people do that has some degree of evidence, and they do it in conjunction with to complement the conventional care they get. We used to say complementary and alternative medicine. Well, alternative is stuff people do instead of conventional medicine that may or may not be rooted in evidence. So integrative is one that at least refers to the best available evidence to try to optimize a person's quality of life in relation to their mind, their body, and spirit, right? And so for mental health, there are many herbs that people do use. And I just want to highlight some because these are all things that actually have medicinal effects. So you can't just go to the store, buy it, and start taking it, because if you have other health conditions, it may work in magnifying the effect of your medicines or in blocking the effect, and that could lead to some harmful potential consequences. So you want to work with your healthcare providers if you're going to think about things like that. Ashwagandha is an herb that actually is used for stress management with some degree of evidence, but it also has mild estrogenic effects, right? And so that's something that we have to be careful about, depending on what other health conditions we have. Vitamin D is thought to benefit energy, mood, muscle aches and pains. And again, before you start taking it, you should know what your level is, and that's something your healthcare provider can help you with. DHEA is actually a precursor to, that helps to convert testosterone and estrogen balance in the body. And after the age of 40, that starts to go down, but that can actually help uplift our mood and may even have some anti-aging effects. But again, it's hormonal, so we have to be very careful about that, right? Tryptophan and this 5-HTP that people use are precursors to serotonin, feel-good chemical in the brain. So think about what Prozac effects or Zoloft or some of these other medicines that are antidepressants, and these precursors impact that as well. Something called SAMe that people use has effects similar to antidepressants. Omega-3. So omega-3, think about fish, right? So cold water, fresh water, wild-caught fish, eggs, nuts, avocado, olive oil, sunflower and pumpkin seeds, chia and flax seeds. So again, through food, you can do a lot. And whenever people think about supplementing, I first want to know about their nutrition. Are you eating healthy? Because that's the foundation. You know, you can't go eating a fatty, greasy, fried meal, then take a multivitamin and call it a day. That's not how it works for the body, right? Folate, folic acid, again, that's vegetables, right? Those are your vegetables, and that can actually enhance serotonin function, and that has value, right? B12 affects folate metabolism, right? B1, again, has an effect on enzymes and hormones that affect your mood. B6, vitamin B6, again, deficiency of it reduces production of serotonin. So there are some core brain neurochemicals, and a lot of these other vitamins actually impact their ability to maintain and sustain, right? So eating the foods that are rich and healthy in these is very, very important. So vegetarians, people that don't eat any kind of animal protein, are not going to get B12. And so for them, supplementing makes sense. For many people in our communities that eat some type of animal protein 2-3 times a week, for them, they're probably getting adequate B12. And how do you know? You can actually check a level, right? So speak to your healthcare provider about that. But the bottom line with nutrition is a healthy diet, right? And I said as per the Core 4 handout, but primarily that Harvard evidence-based food plate is actually a wonderful plate, or Harvard healthy eating plate is a wonderful resource, right? Gut feeling, right? Take a nutrition and diet history for a week, write down what you eat, and then look at it, right? Where's the sugar? And with nutrition, again, the thing to remember is there are no bad food groups. Between carbohydrates, proteins, and fats, there are no bad food groups, but there are bad foods within each group, right? So you have to be wise about what you're eating within those groups, and portion, proportion, preparation, and timing are important when it comes to food, right? So portion control, right? Proportion on a plate, let half your plate be vegetables, right? I'm not talking about tempura style where they're fried, but you know, between salads, cooked, and in fact, a little bit of pickled vegetable actually can help with digestion too, especially if you tolerate it, right? Preparation, right? So fatty, greasy, and fried is no way to go through life, right? So preparation as a food matters, right? And when we say that, specifically red meat comes up as a question. With red meat, the main issue is the preparation. So cooked on high heat, charred or well done, and there's a chemical called dioxin that's formed that's been associated with colon, bladder, and then in men, prostate cancer. So when it comes to red meat, preparation, you know, matters a lot in terms of cooking on medium heat, cooking somewhere in the medium range, depending on the type of cut, and not charring it, right? The gut-brain axis is bidirectional, right? So your food affects your mood and your mood affects your food in terms of digestion, because we know that when people have a high stress state, their gut bacteria actually changes. And when people have healthy gut bacteria, it actually impacts their mood in a positive way, just as negative balance in gut bacteria affects it. So when we end up on antibiotics, when we eat foods that are sugar rich, it shifts the bacteria in our gut, and that's our highway of nutrient and toxin exchange. And if that's off, nutrients won't get in, toxins can't get released, and it leads to cortisol going up. That also impacts the brain and creates a higher potential for distress, right? So that's important. That's why we talk about things like prebiotics and probiotics. Prebiotics are your vegetables. probiotics are the things like yogurt is a classic source of probiotic. That's a nutritional source versus pillifying your life, right? So that's important. So embrace your chassis and keep your engine finely tuned. This is about physical wellness and physical fitness, right? When you look in a parking lot, all the cars have different shapes, right? As human beings, we all have different natural genetic built, right? And then what we want to do is focus on building healthy from the inside out, right? Keeping the engine finely tuned comes from our thoughts, our physical activity, the biochemistry, the nutrition, all of those things combined impact the engine, which then affects your chassis, right? And keeping it going, right? So that's important. I like this image. That's why I put it together. My dream car in high school was actually a minivan, and people still smile about that. But, I always knew I wanted to have a family, and in a car like this, if I had a family, they'd all be scrunched in. But in a minivan, you got room, you got space. And so when we were at a stage in our family where we could have a minivan, we definitely had a minivan. I've yet to get a sports car. I don't think I would get a sports car. That's just not me. So exercise has a lot of benefits. So what does it do? In the brain, it actually affects similar to antidepressants and electroconvulsive therapy, right? Reduces the stress hormone excretion of cortisol and even the fight, flight, or freeze response, that epinephrine or norepinephrine. And so it has a lot of value, plus releases endorphins, which actually have a relaxant effect. So when people talk about, I just got to get a good workout and then I feel better, you do feel better because the biochemistry gets affected as well. And then over time, you feel improved energy because your muscle tone is better and you do better, right? Acupuncture actually is another integrative approach, complementary approach that has shown that electroacupuncture plus an SSRI medicine, which is like Prozac or Zoloft or Lexapro, that family, was superior to just the medication alone, right? And in fact, electroacupuncture was as effective as the medication for mild to moderate depression. Omega-3 at about 3,000 milligrams a day has been shown in some studies to be as effective for mild to moderate depression as an antidepressant medication, right? And again, you can get it through your foods, right? So when you can get it through your food, then that's the first place to start. So if you feel like you got a mindful mess, try mindfulness. This is about stress management, right? And mindfulness is about bringing yourself back to the present and then gaining clarity, right? Again, root cause for how you're feeling, right? Being here now, right? So here are some steps you can take, right? Get to know the lay of the land, right? What's actually happening? Write down everything that you want, right? Make your wish list, right? And then from that, circle your needs, right? Now, what are the two needs? Contentment and peace, right? So fundamental basics that allow for contentment and peace. Everything else is a want. If any of your wants take away from those which are your needs, then think about where your priorities lie, right? So when you write down all your stressors, you make two columns. I had one lady who had so much stress, I said, hey, write it all down for me so we can get an idea. And she came back with 8 pages in a 15-minute family doc visit, right? And so we said, okay, make 2 columns, things I can do something about and things I can't control. And when she came back, 1 page was hers to own. The other 7 were stresses in her life, but things she wasn't directly responsible for, right? None of us as an individual are directly responsible for what's happened to the world with COVID. And yet, what can we do about it? We can control our behaviors, our approach on a daily basis, our engagement, right? Our self-care to maintain our health so that we're less likely to get sick, infected, etc., right? And so this lady every day, every time her mind went to the things she couldn't control, for the same time and energy, would take one thing she could do something about, make a plan, get it done, and then erase it with a marker. And then at nighttime, she'd look at how much she got done from her action item list and acknowledge to herself that, you know what, I'm doing my best at actively living my life, right? All that other stuff is the stuff on the shelves that other people put on and other people can take off, right? And so in doing so, after a month of reflecting in this way, she got better at when a stress came, rather than absorbing it, she would actually look at it and think about, here's my steps A and B I can do, The rest of it is out of my hands. And so I'm not going to worry about and stay stuck in the things I can't control, because for that same time and energy, there's stuff that I can get done, right? Proactive living versus reactive and reflective, right? So that's important, right? And write down all your barriers, right? So what are the things that prevent you from achieving contentment and peace, right? Once you define them, you have an opportunity to make a plan to overcome them, right? And that's important. So then you realize, what can I let go of? And how can I overcome the barriers? And what are the alternate paths to my goals? You know, I recently heard a great quote. It's not mine, but it's a great line that, you know, you write your goals down in pen and write your plans down in pencil, right? So that your goals can still maintain, but the plans may have to adjust and adapt depending on circumstance, right? And sometimes you may add steps, sometimes you may be able to skip steps, right? And it all depends on what's happening, but you maintain that goal, right? And that's important. The other thing I'll also say that kind of counters that a little bit is, you know, I get a lot of students who come in to medical school thinking, well, you know, I want to be a neurosurgeon or a plastic surgeon or a family doctor, whatever they have their preset notion from when they were, you know, 4 or 5 or 10 or had a life-altering experience. And what we remind them is, allow the journey to help mold who you become, right? So too often we hold ourselves captive to the dreams of our 5-year-old self or our past self. And the problem with that is that then it's not fair, because you've had a living experience in between and you're completely discounting the value of that, because that might create a shift. But if you say so stuck on that, well, since I was 5, I wanted this, so I have to get this. Well, maybe life has taught you otherwise. And that, you know, that was nice, but I'm learning that life is actually much different, and that maybe there's meaning in different things in my life now, right? And so be willing and be open to even take that goal and adjust and adapt it so that you can embrace that sense of contentment and peace for yourself, right? And that's important. And so this mindfulness idea, it's about where you put your attention, how that's impacted by your intention, right? And your attitude. And these three, and this is something, so mindfulness-based stress reduction is something that a gentleman named John Kabat-Zinn has actually brought forth since the 1970s. He's a professor at University of Massachusetts and has done a lot of work and published wonderful work, and actually has this training course called Mindfulness-Based Stress Reduction. It's an 8-week training program. So if anybody's interested, they can look that up for sure. And it allows an opportunity for us to train ourselves to be more mindful and to also gain greater mental fortitude or mental wealth, if you want to say it that way, right? And all of that stuff actually comes to what I was talking about before with the biochemistry. So this was published in 2015, 10 minutes of belly breathing, okay? And so again, I'm gonna, at least I had the screen down, but I'm gonna just put this up so you guys can see me. And I'm wrapping up, Jess, so take a deep breath, right? In fact, I'm gonna have everybody take a deep breath. So I'm gonna stand up, okay? I'm not ashamed to show my belly, it's all good. So I'm gonna stand, and what I want people to do is just put your hand on your stomach, right? So most people, when they take a deep breath, their chest goes up and then comes down, right? What we want to do is take a deep breath where our belly actually does the work. So when you take a deep breath and you breathe in, your belly should actually push out, okay? And we breathe out, the belly sucks back in. I got to hold my breath to suck it in. Just kidding. So take a deep breath, the belly should push out, in, and then when you breathe out, the belly pushes back out. And for many people, this is very difficult, okay? It's difficult because our natural instinct is that when we breathe in, the belly goes in. When we breathe out, we sit sunk down and the belly comes out, right? So if you keep your hand on your stomach, when you breathe in, push that belly out like a balloon, and breathe out, allow that belly to just suck back in. And what you do is you breathe in slow, you breathe out even slower. When you do that for 10 minutes, cortisol goes down, right? So as I mentioned, blood pressure, blood sugar, immune system, inflammation, and precancerous change all get reduced, right? That DHEA goes up. That's actually got some potential anti-aging effect. Serotonin goes up, which helps your mood and your digestion, right? Melatonin, which people use for, sleep, actually benefits your immune system, right? Dopamine goes up. I can get y'all doped up just by breathing right? Think about that, right? Think about how we change the color. Yo, man, I got your dope right here. Just breathe, right? So that's important, right? And then the adrenaline, the fight, flight, or freeze response calms down. So you want to think about the fact that your breath, which you're doing anyway, when you do it in a more optimal way, right? You can actually enhance your health and your mental health, right? So physical health gets improved, mental health gets improved, body biochemistry gets improved. So what I tell people is 10 minutes in the morning, setting your intention for the day, 10 minutes at night to express gratitude for the day that was. And the way I do it is I think about my heart as a cup. So when I do the 10 minutes of breathing in the morning, I'm filling that cup up with a sense of love. And then the overflow is what I share with the world all day, because you know what? I can give that unconditionally. But if I empty my cup, now I'm struggling, I'm seeking, right? I need something back, right? And so that puts me in a distressing position. But if I give the overflow, hey, if you choose to accept it, great. And if not, I wish you well, right? In fact, that's a great phrase. I wish you well. I really learned it in 2018 after all these years, which was, you can, I wish you well and embrace somebody. And then sometimes you got to do the, I wish you well, right? And distance yourself, right? And it's important because that's self-preservation too, right? So think about that, right? And that's a great opportunity to do the deep breathing, but that impacts you. And 10 minutes actually lowers your blood pressure by 5 to 10 points for the entire 24 hours. That's about a 2.5 to 5% risk reduction for stroke and heart attacks, right? Pretty amazing, right? It's your breath. All of you are doing it right now anyway, right? So that's important. Harvard looked at people for 8 weeks who averaged 24 minutes a day at a time. And by the end of 8 weeks, they were doing functional MRIs of the brain. And what they found was that the flow and the energy in different parts of the brain, the density actually changed. So little structural cellular change with your breath, right? And again, you don't need hi-fi technology. Think about the fact that your cell, your human cell, is probably the greatest nanotechnology we know. And all this money we're spending on science is actually just gonna help us to come back to making a cell, right? It's already in you. In fact, the number of atoms in your body are only off by 1 power of 10 from the number of stars known in the entire known universe, right? So you're pretty freaking amazing, right? Think about that, right? And you think I'm just saying this stuff? This was published in 2012, right? So they were looking at happiness and sustained happiness. What they found was when people hinge their happiness on something outside of themselves, they yo-yo through life. If you got it, you were happy. If you didn't, you were sad, right? But when you realize and have this sense of what they call durable plenitude, I am enough, right? That I am enough. Now you can actually have sustained happiness. And if you get the thing, great. If you don't get the thing, you fall back to I am enough, right? And so what it allows you to do is still have goals, but not feel distressed if things don't work out, because you know what? You tried. And there's value in that experience as well, right? And then we move on to the next thing, or we adjust and we adapt, right? And we think about our relationships. I think about this, and I'll wrap up. Relationships are like a ladder, right? Where the two posts are held together by the rungs, right? And these are the rungs of a healthy relationship: commitment, honesty, communication, love, availability, mutual respect, compromise, forgiveness, acceptance, caring, sharing goals, trust. And I went through and said all these just in case somebody's in a car and can't really see and they're podcasting us. Well, then now you've heard the words, right? So Jess, I'm being cognizant of that, right? So, I used to say that, if the rungs aren't there, the two posts tend to drift apart, right? And so we have to constantly reinforce them from both sides. And I thought I was a genius coming up with this analogy. And then a few years ago, I was making slides for my med students, and I came upon this picture of a ladder. It's DNA. It's already inside of us. This is how we actually exist. This relationship, these bonds that come from both sides, right? If they didn't exist, we wouldn't be around, right? So nature already has answers for us. We just have to pay attention, right? You are a marvelous being, even on days where you feel distressed and you feel down, and on weeks and months. Remember one thing: We're magnificent just being here. Think of the process involved in just us being here today, right? It's an amazing thing. For a moment, celebrate that fact, and it will shift your mindset because you'll be like, wow, right? And that's a good thing, right? That's a good thing. Also with relationships, what you have to realize is peace begins within. If you're not at peace, none of your relationships can have peace because you're a part of that equation, right? And when you're at peace, all of your relationships have the potential for peace because you're a part of that equation, right? So is it easier to fix 50 or to work on self, right? So find your peace and what that means, right? And these circles of peace are about the fact that, you know, self, then couplehood, children, parents, extended family, friends, and then everyone else. And if any of the outer circles are affecting your inner peace, think about where your priorities lie, right? So if you're going to choose an inner circle over an outer circle, and you can be at peace with that, right? So sometimes, you know, it's couplehood over extended family, right? Because that matters a lot. And so take some time to just reflect on, just for today, what will you walk away from, right? What will you embrace? What will you release, right? And this is a meditation you can do. What will you focus on, right? What will you not accept? What will you or who will you love unconditionally? And then you can fill in the I will, right? What will you do, right? What will you do? Have the mindset of a thriver, right? And rise to the challenge, right? And thrive. I learn from my mistakes, make new mistakes, and I thrive. I don't just survive, I thrive. I choose thrivership, living proactively, embracing each moment, creating the living, loving moment, choosing contentment and peace, not just hoping for them, making them, embracing them, right? Some people live as if they're dying, right? I choose to live like I'm living, appreciating each moment as bonus, a blessing, and so I thrive. Be the driver of your own destiny, right? Be a thriver, right? And love unconditionally. And this is pretty much the last slide. And this loving unconditionally, I got some greater wisdom about a year and a half ago. The human heart beats 86,400 to 144,000 times a day with a normal heartbeat of 60 to 100 beats a minute. Now, every time it beats, it sends off blood, doesn't know where it's going, doesn't know what it's going to do, doesn't know whether it'll be received or not, and yet it keeps on giving unconditionally. And we use the symbol of the heart for love, literally giving love unconditionally and showing us the way. And when that blood comes back, it doesn't know where it's been. It doesn't know what it's done. It doesn't care what shape it's in. It opens up, embraces it, nurtures it, and then releases again, right? Literally receiving love unconditionally. So if our heart can do that 86,000 plus times a day, how can we not be the embodiment of that? So in any given moment where you feel stress, distress, anxiety, fear, right? Recognize that your heart is showing you the way. Just come back to your breath, come back to your heart, keep filling your cup. And what you'll find is you'll suddenly be giving unconditional love again, right? And whatever comes your way is going to be bonus anyway, because you don't need to fill you up. It's bonus, right? So I always like to say I'm full, not full of it, just full, because I'm doing that for myself, right? And that's important, right? Dream big and make it happen. I might not be able to sky like Jordan, but you know what? I got game, right? And I want you all to have game too. And remember, be your best and just focus on making today better than yesterday. And you'll look back on a life well lived. But if we save for tomorrow what we can do today, we may look back on a life unfulfilled, right? So I'm going to stop there. I wish you all well. These are some of the references as well. And I'm happy to take questions if there are any. And I'll stop sharing the screen.
Well, thank you so much, Dr. Nanavati. I'm hearing a little echo on myself. Okay, hopefully that'll go away. Are you guys hearing it too? Okay, it's just me then. I wanted to first thank you so much for this incredibly generous offering and teaching. I know personally that I've learned so much from you, and I know that everyone that tuned in tonight is take away some wisdom that I am sure that they will take with them. And I want to invite everybody to please submit your questions into the chat so that we can get them to Dr. Nanavati. And I wanted to begin with one. So I know that I personally have been, and many of my friends and family and people that I'm close to have been in a place where we're suffering, like really suffering, and can't imagine moving towards a life of balance because things feel so bad and because the world closes in, right? So if we are in that place, and let's say we encounter the wisdom of the core four, right? And we understand it, but are having a hard time imagining how we might be able to get there because of where we are sitting in that moment. What would you recommend, or what do you say to somebody, who is struggling to make a first step?
So there's a gentleman here in Syracuse, and we haven't met yet, but I get to see a lot of his work. And he's got a movement called We Rise Above the Streets, a gentleman named El Amin Muhammad. And, he was a homeless gentleman who came to Syracuse and decided that he would start feeding the homeless. So here's a homeless gentleman who wants to feed the homeless, right? And the lesson learned there is when we feel so stuck that we're not sure what direction we can go in, one of the pearls that I've learned in life is think about what you can give in the moment rather than what you can get, right? So if we start to look towards what we can offer, suddenly we start to find value in who we are. Because if we think about, well, what do I need right now? What can I get? I'm stuck, I need, right? And from there we go to the, well, in this moment, what can I give? And suddenly you start to find a crack, right? And, as they say, the crack is where the light comes in. And so you'll start to recognize that even at this time where I feel so low, I have the ability to actually help somebody with my presence, even with a phone call, even with a hello. And those simple things, right? Technically, even when you fake a smile, that serotonin goes up and cortisol goes down, right? And over time, if you keep faking that smile, eventually you can't help but actually become real, right? And so what I would say is somebody feels really stuck, really low. A lot of times my patients, what I'll think about is, have you tried volunteering, right? Or have you reached out to a family member and asked them how they are versus wanting them to ask you how you are? Suddenly you'll feel uplifted, right? So oftentimes it's about what we can give, and all of us have the ability to do that with at least one person, whether we know them or even a stranger, through volunteering. And suddenly it shifts our own sense of purpose and meaning, right?
Absolutely. I have a sort of a follow-up question to that too. And again, please put your questions in the chat, everyone. So a follow-up question to that is that, I think a lot of the things that you were speaking about tonight really spoke to the value of resiliency, and thinking about being able to, that being such a core part of well-being, and being able to both fill a cup that's so full, right, that you can give freely, right? And that when that cup empties, you're also then able to fill it. So I was wondering, where does resiliency come from? Like, how do you build resiliency if it's not something you identify with? How do you grow it? How do you build it? How do you identify it?
And I'll say the word resiliency, we had a conversation within our institution about that word because, it's used a lot, right?
Hmm.
So, well, you need to be more resilient, and, you should be more resilient, and, resiliency is the answer. And, sometimes it's hard to do that, right? And so, the goal with some of the content was actually to show, especially that side about sustained happiness, right?
Hmm.
That's really about resiliency, which is recognizing the value from within. So we look for something outside of ourselves to help us be, even a training course and all that stuff, right? And my intent is to help people understand all of what you need lies within, right? It's accepting it and it's embracing it. And so in building resiliency, the most important thing is to be able to embrace ourselves, to say, you know what? I got game. Like, I'm enough, right? Now, that being said, I got goals, right? And right now, if I feel beat down, as I said before, the champion is the one who gets up one more time, right? So as you start having the mindset that, you know what? Yeah, I may fail. This sucks. I'm in a lousy spot right now. I'm not sure what direction to go in. But when you're not sure what direction to go in, pick any direction, right? And then change, right?
Mm.
direction you like, change, right? So in life, at any given moment, we have two choices. We can choose to be at peace, or we make the other choice. The choice is always ours. We can't point the finger elsewhere because ultimately we choose, right? And I'm talking about choice anywhere in the world for anybody, even when we are in situations of dire distress and stress. The one thing we can do is look within, right?
Mm.
And hold our head high and at least represent ourselves in the manner that we would want the world to represent in, right?
Well, thank you so much, Dr. Nanavati. It seems that everyone is just receiving all of the information that's washed over them, so we don't seem to have any additional questions. But I would love to offer you an invitation for any closing thoughts before we say goodnight.
I think the most important thing is to realize, if there's one master key to the whole thing, it's unconditional love. And how we learn that over time is a matter of daily practice and offering it to ourselves, right? So first, fill your cup, right? Be the rooting, right? And root your tree before you start trying to offer shade to others, because in that process, you'll be stronger, and more importantly, you'll be even a better resource for community. So none of us are 100% in this place all the time. I'm human. In fact, my wife always reminds me, that I'll get mad, I'll get sad, I'll get upset, all these things. And my point to that is we all feel the feelings, but if you think about your life as a soup, right? And you sample it every so often and you don't like the flavor, right? How are you going to change the flavor? By adding more of what you like until that becomes a dominant flavor, right? So taste your soup, right? And if you don't like it, make a change.
Thank you so much. I happen to really love soup. I have a soupstagram, so I really appreciate
Hey, see, I didn't even know that, but we're connected already. This is awesome.
I really appreciate it. We got a couple just comments and I'd love to read them and then, wish everyone good night. Stephanie Michaels, who is a very big fan of yours, says, thank you so much for your generosity and sharing your insights. And we also have from Abby, Dr. Nanavati, this presentation spoke to me on so many levels, especially finding internal happiness versus external. And also as someone who has put off applying to medical school for so long, it was eye-opening. Thank you for such a plethora of wisdom and useful facts, tools, and thoughts to help improve our mental wellness. Taste your soup. I love it.
That's what I'm talking about.
Well, thank you so much, everyone. I wish you a really nourishing evening, and we look forward to seeing you again soon. I will be sending out a follow-up email in the next couple of days with a link to the videos so far from this series, and also information about how you can learn more about Dr. Nanavati and his work. So please do come back to us if you have any questions or anything. Reach out to me. You can reach me at virtual@ymcacny.org. Have a good night, everybody. And thank you so much, Doctor.